Thank you, Madam Chair. Members, good morning. The COVID information is linked to, as this is not our, I'm actually here, so you'll find me in a second. I'm doing it. The COVID information is linked to in the board packet. This is our off week where we are not doing a full COVID update, but there were a couple of pieces of information that I did want to share briefly this morning as there are developments that were important to bring forward. First, on testing, the Minnesota Department of Health has been in communications with our public health department and have reported that they are close to an agreement to announce semi-permanent saliva testing, first at an interim location as they work on the long-term semi-permanent location. We are hoping for that announcement to happen within the next few days, seeing as how November 1st is only a few days away. That'll run 7 days a week and be accessible throughout as a semi-permanent location across our community, in addition to all the other testing work that is being done both by our healthcare systems and Ramsey County testing events, and our continued work to expand testing at Bethesda. So stay tuned for more on a semi-permanent testing location announcement from the Minnesota Department of Health. We had a mask event on Saturday, October 24th, where we handed out reusable cloth face coverings to 610 people. A total of 3,351 masks were handed out during that event, which continues to demonstrate the importance and power of working to get in community and the work of our racial equity and community engagement response team who led this work. It was busy the entire 4 hours that the event took place. In addition to the masks, there were over 300 boxes of food at 30 pounds a box. So if you do the math, half a ton of food, and over 300 gallons of milk that were also distributed during that time. We want to acknowledge Second Harvest and Reverend Joshua Miller, the Jehovah Lutheran Church staff, at Thomas and Snelling Avenue, for providing the food boxes. Second Harvest brought 200 food boxes and we ran out in less than an hour. Later in the day, we found out that Jehovah Lutheran had extra food boxes. They stepped up, their team packed up cars and brought over more food, which gets to how this is truly a community effort together. After the event, we were also able to provide masks to residents at our Best Western Hotel sheltering program. And we then also were planning to now send out 2,192 masks for individuals who indicated interest, but were unable to come to the event physically. I personally want to thank Sarah and Prince from our Racial Equity Community Engagement Response Team, everybody else as staff who are serving on that team, Karma from Emergency Management, the entire Emergency Management Department. It was a big planning effort, but as you can see from the results, it clearly made a difference. I wanted to also share with you that effective October 26th through November 9th, after a positive test result at Lake Owasso residents, we now have implemented strict policies to prevent the spread of COVID-19, meaning no visitors, no overnight visits, no outings that are not medically necessary as determined by nursing, no day program attendance, and residents cannot commingle with residents of other houses even when outside. These are tough restrictions to put in place, but they're important to ensuring that we protect staff and residents at Lake Owasso, and I wanted to share that update here with you. Finally, on the mHealth Fairview Bethesda project that has been ongoing, just some brief updates across 4 areas. In community engagement, there's been much work over the last week developing focused conversations and surveys to a variety of stakeholders. The next community conversation town hall is scheduled for this Thursday, October 29th from 5 to 6:30 p.m. It's designated as a listening session in which we will collate themes of what we are hearing and then answer questions from our subject matter experts. We continue to encourage residents and interested parties to please go to ramseycounty.us/Bethesda for updates. Interested parties can choose to subscribe to a weekly update email that is issued every Friday afternoon. Last week, we met with mHealth Fairview and St. Paul leadership and are excited to all move ahead with clinical services planning for Bethesda in partnership with mHealth Fairview. A joint team has been formed this week, and it'll include cross-organizational clinical leadership and other subject matter experts to ensure that we develop aligned clinical and testing programs so that we ensure that what's happening on the ground, both at Bethesda and in unsheltered communities, is all aligned with our other services being planned. We had good progress last week on the security pieces of our contracting there and feel like that is on track and progressing as hoped. And just generally good progress last week in our work with staff at the Capital Area Planning Board as we work through their permitting and zoning process, and we will be meeting with their staff on Thursday, October 29th. We know that our deadlines and timelines hinge upon those pieces moving forward, and we look forward to the CAP board helping us provide leadership as we work to bring an important project to this community before the calendar date of winter hits. It already feels like winter outside and is a reminder of the urgency that we all face. Again, the COVID information on the dashboard and other public health information can be found on our website and is also linked to in the board documentation. Thank you, Madam Chair.
Thank you very, very much. I appreciate that you have, although we've not had a full update, you shared those items which needed to come before us in the COVID information today. And we're thankful that it is all on our site and can be viewed by anyone interested in keeping track. And as is usual, then I'll ask for a brief moment of silence as we continue through our multiple emergencies.